securing that debt. Another thing I'd like to bring up, we're looking forward to the benefits of staying out of bankruptcy, but that means we're going to go to mediation. We're going to talk to people, suppliers, unions, employees, everyone we can, because we want a solution that's not mandated to settle on. I just want to remind everyone, when we say the district, the hospital, everything is under one license. So the district is the hospital, it is the 2 skilled nursing facilities, it's the 7 clinics, it's everything that we perform. It's all under one license. So when we're working to save the district, we're working to save everything together. Lastly, I was just on the phone today with someone at the state. We're actually working with them to pay us, again, $10 million we've already earned. We've already given care to our residents that fall under the Medi-Cal plan. So we're just asking the state, instead of making us wait till May or June for the funding, actually give us the funding now when we need it. So anyway, it's a lot to cover. We'll let you know the audit for 2022 is posted on our website. And I'm going to bring Mary up here to advance the discussion. Thank you.
Thanks, Mark. You heard Mark say that we operate on very thin margins in healthcare. That is across the United States, meaning it costs us, our expenses sometimes are more than what the revenue we bring in. The hospital's been experiencing that for quite some time. The board and administration have really come to understand that staying an independent hospital is really no longer an issue for us. We are committed to the community to continue the services for years to come. We need stability. We need a strategic plan to increase those services in the future. With the needs that we see for the community, there is no other option than for us to find a strategic partner for Hazel, Hawkins, and the community. We do have a plan in place to get us there. A major component of that plan is time. We need time. As Mark said, in December or in November, we were looking at running out of cash in December. Then we were looking at, we extended it to February, and now we're looking at April 1st. We need more time than that to find a partner. So what is our plan? One of the questions that came in earlier when we were putting this together is, what is the plan to rescue Hazel Hawkins? What are the changes that are needed to take place? What is the plan to sustain Hazel in the future to avoid a situation like this? Are you hoping to be bought out by a partner or be in a partnership? The answer is yes, we are looking for that. And in order to do that, the first thing we need to do is secure emergency funding. We need funding to keep our hospital doors open for a longer period of time to give us the opportunity to find a strategic partner for Hazel Hawkins. We need to look at operational savings, and I'll be touching on that in a minute. That is part of our plan. We are looking to go into mediation with the unions, our debtors, our suppliers, and other stakeholders. And the last part of our plan is to engage an investment banker to help us find the right partner for our community. We are dedicated to finding the right solution for our community, and we are doing it a little bit different this time. The hospitals looked at partners in the past, but we decided to engage investment bankers to help us cast a wider net. We are not just knocking on the doors of our neighbor hospitals. We are looking across the United States to find a partner for Hazel Hawkins to make sure we get into the right partner and partnership. I do want to touch, because I know this is kind of an unusual thing, but what is a partnership going to bring us? That is a question we get all the time. In fact, I had a question come in, what's going to change going forward that would allow the hospital to be profitable? Is there a pro forma developed showing this? I do want to say it's difficult to develop a pro forma until we decide and find out what kind of partnership we're going to go into. There's many different partnerships that we can go into. But I want to focus on what would be the benefits of us having a strategic partner to move forward. First of all, and foremost, preservation of patient access to care. That is huge. We want to make sure we keep the doors open, and a partnership will do this. But not only access to patient care and resources, but maybe new service lines. We would love to have a partnership that can bring service lines like cardiology, infusion care, dialysis to this community. A partnership can do that. We need to look at higher reimbursement. Mark touched on that. Higher reimbursement rates achieved through more favorable managed care contracts. San Benito County does not get the same reimbursement that Santa Clara or even Monterey County gets. Finding a partner will allow us to go in with managed care contracts. For instance, when we go in to negotiate with payers like at Blue Shield, Blue Cross, we don't have the leverage because we're not that big. So having a partner will give us the leverage to get better reimbursement. Having a partner is also economies of scale through group purchasing. Think about it, the more you buy, just like on Amazon, the more you buy, the cheaper it is. If we have a partner that's larger, we can take advantage of group purchasing. We can have improved productivity, enhanced bargaining power, and increased patient volumes. All of that a partner can bring us. Partner would also potentially, most likely, give us access to capital. Right now, we don't have buckets of money for improvements for the hospital. We're hoping a partner will bring us that. Lastly, a partner would give us access to infrastructure and technology in the form of billing, the electronic medical record, telehealth. Those are just a few things that an infrastructure can bring us when we work with a partner. These are all things that the community and the hospital would benefit from if we find the right partner. So that's one part of our strategy. To get us this, what we call a runway of time in order to find the partner, we need some emergency funding. We have gone to the County of San Benito with a proposal requesting an advancement in our property tax. The board did agree to give us a transfer of our April 2023 tax payment in December. So we did receive from the board 1.1 million. We should have gotten it in April. They gave that to us in December. We have also, last week, achieved a $3 million loan through CHFFA. Now, Mark told you we have very little loan debt, but we just received $3 million more from CHFFA to extend our runway. We are meeting with Cal Mortgage on financing options using underleveraged assets. We are working with state legislators to request funding through the state. We have engaged the state treasurer's office. We have engaged and made a presentation to the governor's office. We continue to work with Assemblyman Rivas's office and Senator Ana Caballero's office and Senator Laird's office. We actually have standing meetings with them on a weekly basis. We are all working together to find emergency funding through the state. We continue to also look for private funding. We are not giving up. We are looking down every single avenue for funding to extend the runway that we can. In parallel to that, we are making some operational changes to save some of our expenses at the hospital. One thing we've done is implementing staff reductions through attrition. So when staff quit, we are not replacing those positions. We have also reduced a small number of positions at the hospital. We have also reduced high-priced registry personnel, and that was really a leftover from COVID. We have reduced some professional services to save some money. We also have the exempt staff giving a deferral of their wage increases. I'd like to say that the unions have followed suit and they have deferred their increases this year as well. Just those small chunks of efforts that I just talked about is saving the district over $2 million this fiscal year. We have very, very tight controls over our spending and cash management, which has resulted in net cash flow from the operations. Like Mark said, this is not a debt issue for the hospital. This is cash flow, money in compared to money going out. So we've really tightened the control of that. We also have an audit that we are conducting in our billing area. So we want to ensure that we are maximizing the revenue for the hospital and not leaving money on the table. One of the first areas that we've looked at is the clinics. So we are doing audits in those areas to increase the revenue. Again, that will help lengthen the runway. We have listed a surplus property for sale that is estimated at $2 million. We are renegotiating contracts with payers such as Anthem. That is generating an expected increase in cash flow starting in January of 2023. We are entering into an extended repayment plan with Medicare. Mark talked about the $5.2 million. When Medicare started taking that back from us July 1st, they originally scheduled to take that $5.2 million back in 11 months. Like Mark said, that payment or the withholding of the Medicare payment was over $450,000. We have been successful at negotiating that to extend it to 60 months, reducing that clawback to $60,000 a month instead of $450,000, which is huge for our cash flow. That's just starting right now in January. We are evaluating underperforming departments and looking at potential closure. We have decided to close home health services here at the hospital. That department was looking at losing $1.3 million this fiscal year. We made sure that those services are being offered by other agencies to our residents in San Mateo County. There are 6 other agencies providing home health services, so we know we're not leaving the community high and dry on those services, but we will be saving over $1 million in wages and benefits from closing that department. We have implemented a hiring freeze. We have commenced the mediations, like I've said, with collective bargaining units and our debtors and suppliers. We have also had to develop whole or partial closure of the hospital in case all of this doesn't work, which Barbara's going to speak to in a minute. I just want to say this plan that we have is not immediate. We need the time. That's why we need the emergency funding. It can take up to 9 months or maybe even longer once we find a partner to get the deal done. It depends on what kind of deal we're talking about. So if we are not successful in finding a strategic partner or emergency funding, we will have to look at closing the hospital. And I'm going to bring up Barbara Hawkins to let you know what that will look like.
Hi, I'm Barbara Vogelsang. I've been here with the district for about 16 months. I'm a registered nurse.